the forearm and elbow palpations. So first we are going to start with the proximal radial head, meaning towards the body. So what you're going to do is you're going to basically find the lateral epicondyles, which you find by finding the shaft of the humerus and sliding down. And those are the notches, medial and lateral. Once you're at the lateral epicondyle, you can go a little bit more distal that, and you're going to twist the hand supinate and pronate until you find the radial head, which hers is right here. You're palpating that for a sprain, or it could be a fracture to the radial head. You are next going to do the olecranon process right here. That is going to be on the ulna. That could be for a fracture or a bursitis. Then I have my medial epicondyle, which we just talked about. Slide your hand down for the humerus. Medial epicondyle, lateral epicondyle. The medial epicondyle is going to be for medial epicondylitis. It could also be for little league elbow. Lateral epicondylitis is going to be for lateral epicondylitis. Then I have my annular ligament, which wraps around my radial head. So again, find the epicondyles, go just distal to that, and spin around, pronate, supinate. The annular ligament is going to go right around that radial head and connect to the ulna, which is going to be for a sprain with a P. Then I have my radial shaft, which is on the thumb side. Easiest to do it in supination. You're palpating that for a fracture. Then I have my ulnar shaft. You're palpating this on the medial side, and then it goes up to the olecranon. That ulnar shaft is best palpated posteriorly for a fracture. I also have my distal radius, so that's going to be my whole, find the shaft of the radius and just go to the distal end. That'd be for a fracture. My radial styloid process, I like to do it having them pronated. You go to the end of the radius and you can kind of feel a little notch on the end. So you're just palpating the distal part of the radius for that, and that's also for a fracture. Your ulnar head is going to be on that medial side. If you go find the radius again, but it's going to be on that pinky side, that's going to be on that medial side. That is going to be for a fracture. And the ulnar styloid is the end of that. So just palpate until you feel a little notch. That's going to be also for a fracture. And then I have my distal radial ulnar joint. So just in between those two bones down here, and distal radial ulnar ligament. That is going to be for a sprain with a P. Then I have my radiocarpal joint. So that's my radius and my carpal bones. So just right where that kind of rests, you can kind of move the distal radius up and down. That would be for a sprain or a dislocation. I have my extensor retinaculum. So if I resist extension, so kind of do a Cosen extension test, and the extensor retinaculum is going to be right here on that posterior side. You're palpating that for lateral epicondylitis, a sprain with a P, anything of that sort. I have my flexor retinaculum. If I can do a resisted Cosen test again, but do flexion right over that carpal bone. That is going to be a sprain with a P, a regular wrist sprain. I have my extensor digitorums. So I'm going to resist finger extension, and you can see they kind of pop out and then they go up into the wrist. They're intrinsic and extrinsic. And that's going to be a strain with a T. Then I have my brachioradialis. My brachioradialis is going to go from my lateral epicondyle to my anterior forearm, basically almost all the way to that thumb. So lateral epicondyle, anterior forearm there, and that's going to be a strain with a T. Then I have my flexor muscles. Those are going to be my anterior muscles that go to my medial epicondyle, which would be for medial epicondylitis or a strain. Then I have my palmaris longus tendon, so have them pinky and thumb together and bend up. It's this tendon right here that sticks out, but not everyone has it. Well, palmaris tendon right there, and then the palmaris muscle is going proximally from that. Both of those would be a strain with a T. Then I have my anconeus, which is going to be from my lateral epicondyle to my posterior ulna. So lateral epicondyle to posterior ulna, strain with a T. I have my distal bicep tendon. So if I resist her elbow flexing, and then you can feel that distal tendon, you almost can like hook it. That would be a strain with a T or a distal bicep rupture. I also have my supinator, which is from my lateral epicondyle to my radius. So lateral epicondyle to radius is supinator. My pronator teres is going to be my ulna and medial epicondyle. It starts at both of them, and then it's going to go to the radius anteriorly. So it's going here to here, anteriorly to the radius. That's a strain with a T. We did the distal biceps already. My triceps tendon, I can have her extend her arm, and it's going to be right going to the olecranon up the posterior side. That's a strain with a T. Then I have my brachialis, which if I have her flex again, it's going to be deep to the bicep. So I kind of palpate good going on the medial and lateral side under the bicep. That's a strain with a T. My UCL is the ligament on the inside over that medial epicondyle. That's for a UCL tear. It could be for little leaguer's elbow. And then RCL would be over that radial, that lateral epicondyle, and that's a sprain of the RCL, not as common. Then I have the interosseous membrane, which is in between the radius and the ulna. That would be a sprain. And then lastly, I have the humero-ulnar joint, which would be where that olecranon meets the humerus, and all those condyles. So this whole area down here would be the joint of the humero-ulnar. And then also, we didn't really talk about it, but I also have my ulnar nerve, which is palpated right just posterior to that medial epicondyle, and that's where the ulnar nerve would sit, right in that ulnar groove. Thanks.